Just a little introduction on myofascial cupping therapy done at home. So using these cups is really helpful to release the connective tissue around the muscle, and it can easily be done at home. There's going to be a couple little things I want to show you so that you're aware of how to do it. And so here we go. All the different size cups are used for different areas, and you'll figure out which cup is best. You can use oil or lotion. You can also just keep them in the shower and soap up and put them on in the shower. That's also quite helpful for people with IT band issues or issues with the neck or shoulder. So that's a medium-sized cup that's a really good one for the top of the shoulder. For the lats area and for the back of the shoulder, you can use the large cup. And then for the neck, you would use a small cup. And these can be moved around quite easily. If they lose suction, you just reapply them. If the cups are really getting purple, that can be a good thing initially, but you want to be a little bit careful. Do not leave the cups on for more than 20 minutes in one spot. And to take them off, you just let a little bit of air in, then you can put them back on again by squeezing down on the top and then putting them on the skin, and it creates the suction. So again, we're pulling the connective tissue away from the muscle. Really good for any kind of inflamed area. And moving them around is a great massage. Same for the back of the arm. Again, the medium-sized cups are good for this. The small cup is good for the forearm. And so you can just follow the pain. For carpal tunnel, you can start at the elbow and move down, releasing the fascia a little bit at a time till you get to the carpal tunnel, which is right at the wrist. Again, using lotion is a really good idea. Sometimes it's not going to stay very well at the junction of the palm and the wrist, but you can keep trying, and it does help to release that carpal tunnel. For the hip, you've got the muscle for the IT band, which is called the tensor fascia lata, and that's right on the side. So I use a big cup on that one. That's a really good release for the hip and for the IT band. And then a smaller cup just at the top of the glute medius muscle. For plantar fasciitis, cupping the calves is very helpful. And so you would go right up the Achilles to the junction of the two calf muscles and put the medium-sized cup there. And then the larger cup could go on the outside of the calf. That's more for plantar fasciitis that goes along the side. And then for plantar fasciitis that goes right to the ball of the foot, you go slightly medial on the inside of the calf. Again, leaving these on for 10-15 minutes, it's really great. Plantar fasciitis, you can also use the small cup on the bottom of the foot. Doesn't suction super well for very long, but it can be helpful if you can get a good suction on there and leave it on for a bit. So I just wanted to give those little demos. Do not cup the front of the neck. Do not cup the breast tissue or the torso. It is not really indicated because, again, we are releasing fascia and muscle tissue. We're not trying to rearrange organs. So please don't do that. And the front of the neck has a lot of vessels. The other areas to be aware of are the inguinal area, so the groin area. Do not do any cupping in the groin area. Again, large vessels are coming through there to the legs, and that can just cause it probably doesn't cause any damage, but it's just something that we don't do. If the cups are left on for too long, you can have blisters. So please do not leave cups on for more than 20 minutes, and always keep an eye on them to make sure you're not getting blisters. It's a very rare event, but it can happen. And finally, beware, just a little extra caution if people are on blood thinners. The cups should not stay on as long and should definitely be monitored. And that's about it. So I hope that this works well for everybody. And always call me if you have any questions or concerns. Take care.